The President. Good morning, government officials, LegCo members. Question 1, Mr. Vincent CHENG. Thank you, President. The pilot program on community living room, the program in short, adopts a tripartite collaboration model of the government, the business sector, and the community to provide subdivided unit households with additional living space and help them expand their social networks. There are views that the government should review the effectiveness of the program and enable more people to benefit from services such as shared kitchens and shared learning spaces. In this connection, will the government inform this council, one, of the number of additional CLRs, community living rooms, planned for this year, and the implementation timetable and the measures in place to encourage active participation in the program for all sectors, including the establishment of CLRs in districts not currently covered, but with a relatively high concentration of SDU households. 2, as the government has stated that the KPI set for the program is enabling no less than 70% of members to experience an enhancement in their living space, sense of belonging to the community, and interpersonal networks after using the facilities in the CLRs, of the respective performance evaluation results. And 3, as there are views that the program should extend it to cover a wider range of beneficiaries and that more diverse services and activities should be introduced, whether the government will consider extending the program to low-income persons, among others, and providing members with information on government recreational and sports activities. If so, the details, if not, the reasons for that. Secretary for Labor and Welfare. President, the pilot program on community living room launched by the current term government is a key initiative for targeted poverty alleviation tailored for the needs of SDU households. Through the tripartite collaboration of the government, the business sector, and the community, the program is spearheaded by the government, with premises provided by the business sector and operations run by NGOs commissioned through the funding from the Community Care Fund. It provides SDU households with additional living space and helps them expand their social networks, thereby enhancing their living standards and sense of belonging to the community. My reply to the questions raised by Mr. Vincent CHENG is as follows. 1. Since the launch of the pilot program, at the end of 2023, a total of 13 CLRs have officially commenced operation. 5 more CLRs will be set up by the end of this year. So by the end of this year, we're going to have a total of 18 CLRs. All of the existing CLRs are located in districts clustered with SDU households. When identifying suitable locations for new CLRs in the future, we will strive to target districts lacking such facilities to benefit more SDU households. 2. The government has set 3 KPIs for the pilot program, with a target of enabling no less than 70% of CLR members to experience an enhancement in 3 areas, namely their living space, sense of belonging to the community, and social networks. In this connection, the government commissioned a university research team for the evaluation. The results show that the pilot program has far exceeded the 70% target in the above 3 areas. As reflected in the growing number of CLR's members, the demand among SDU households for CLR service has yet to be fully met. In addition to providing basic facilities, including communal living rooms, pantries, study areas for students, and self-service washing and drying machines, many of the CLRs also have additional facilities such as children's playroom, shower room, fitness areas, music room, multimedia activity rooms, and household goods swap nooks to enhance the quality of life of service users. Moreover, on-site social workers as CLRs will refer service users to appropriate community resources and services according to their needs, such as integrated family service centers, integrated children and youth services center, and neighborhood elderly center. Information on various daily life aspects such as health and sports, hygiene, and home safety is provided. While different types of group activities, including stress management groups, parenting education program, and family mental health activities are also offered. In other words, CLR not only address the substandard living conditions of SDU households, but also provide diverse support to members living with the elderly, young kids, and school children, as well as those serving as carers. The government will continue to review the operation of CLRs and the changes in service demand among the public, allowing for timely consideration of whether to extend the service to other persons in need. Thank you, President. Please keep your questions and answers short. Mr. Vincent CHENG. Thank you. The Secretary said that within this year, we're going to set up 5 more CRRs. This is definitely a piece of good news. Currently, CRRs operate on a trial basis through the collaboration between the business and the government. The contract with the business sector lasts 3 years. I wonder if the administration will regularize the program. After regularization, can we continue to encourage the business sector to offer sponsorship to make better use of the premises? Thank you. Secretary, that's a great question. The program has been launched for about 2 years. The first CRR in Shamshipo have been commissioned some 2 years ago. I think it's early to say whether or not we should regularize the program. For the first 4 CRRs, with the support of the donors, we are going to extend them for 3 more years. So for the CRRs that are about to expire, we're going to extend them for another 3 years. When the demand of SDU households have been met, we may extend the CRRs to other people in need. Dr. David Lam, thank you. The program is a great one. I visited some of the CRRs myself. The social workers have close ties with the CRR members. When members come across illness, disputes, they reach out to on-site social workers as CRRs. However, CRRs does not have the resources to offer social service to members. But because of the good relationship, the on-site social workers are able to help out. I wonder if the government will dedicate more resources on this area. Thank you. Secretary. President, I thank Dr. Lam for the question. The program have been in operation for some years. We note that CRR have become a network. When members and service users come across with difficulties, they reach out to the staff members and social workers. We know that NGO that operate program are either large NGO that offer social service on their own or have close relationship with the social welfare sector. They're not there to address family or health issues. Sometimes they help them find jobs even. The NGO sometimes refer users to VTC. Mr. Chen. Thank you, President. I recognize the effectiveness of the program. It offers additional living space for SDU households and help them expand their social networks and help the children. But the distribution of CRRs are not even. The government said that in Taipo and Sha Tin, there are 3,500 and 1,500 SDUs respectively. However, CRRs are mostly concentrated in Kowloon. I just talked about the Taipo Old District in Sha Tin, Taipo and Sha Tin Old Districts. They are clustered with SDU household. Secretary Ho and I went there. There was no CRRs. Neither was there anyone in Tumun. Should we not extend the CRRs to other districts? Secretary, thank you. Mr. Chan's observation is very much correct. Most of the 13 CRRs are in Kowloon. We have a few in Hong Kong Island. In Sha Tin, Taipo, Tumun, we don't have any. That's true. So I'd like to appeal to members, if there's anyone who is willing to offer us premises, we are very much willing to extend. We're going to cover Chumon and Kwai Chung very soon. We hope that there will be CRRs in districts where there are SDUs. Mr. Augustine Wong, thank you. After declare interest, I participated in the work of CRRs. The government, in the reply, said that the intent of the program is to provide SDU households with additional living space. But in the process, for families with children and for carers, they are able to receive assistance in the program. As we eradicate substandard SDUs, Should we not extend the service scope of the program to take care of more people? Secretary, thank you. Mr. Wong has offered us much support in the program. I thank him for that. First of all, we'd like to now just focus on SDUs, but when the demand and needs of SDU households are generally met, we want to help more people. As to whether we should regularize the program, we need to continue to observe. We have achieved some great results through the tripartite collaboration among the business, the NGOs, and the government. We will review the program in due course. Mr. Chen Hao-Yan, thank you. For Sam Shui Po, as an example, the CLRs there help SDU households very much. I reached out to the NGOs that operate those CLRs. The NGOs worked very closely with the district health centers to offer extra service to SDU households. We have addressed some hidden problems along the way. So I have a question for the secretary. Apart from shower rooms, kitchens, can we offer additional service at the CLR, say, for example, eye check, dental check? Perhaps we can offer such service in the CLRs for a week in the year to make our service more comprehensive. Secretary, I thank Ms. Chen Hao-Yan for the questions. When we operate CLR, we work with the business sector and the NGOs. We do have flexibility in the service that we offer. We ask them to provide some basic service, but they are free to offer more services, such as the ones mentioned by Ms. Chen Hao-Yan. NGOs may offer on-site service, and I believe that if there is willing partners, this can be achieved. Hopefully, apart from social welfare service, we will be able to provide health-related service at the CRR as well. Mr. Chen Chen-Ying, thank you. The secretary just said that the program is run through the tripartite collaboration. The business sector provide premises, NGO run the CRRs. In the business sector, many companies have a charitable fund. They are not just able to offer premises, but also monetary contributions. It is said that under the program, the business sector can only offer non-monetary sponsorship. I wonder if we should allow the business sector not just to provide premises, but also make monetary donations. Secretary, of course, we're willing to accept monetary contributions if they have extra resources apart from sponsoring the renovations and premises. We're happy to take that. Apart from the donation and funding from the Community Care Fund, we do have donations from some enterprises and NGOs. I'd like to take this opportunity to appeal to the business sector to make donations. Thank you. Dr. Junius Ho. I fully support the pilot program on community living room. The business sector offer the program with monetary support and premises, which can only be used for a very short period of time. Over the long run, how can we integrate this idea of community living room into the community truly? This morning, we talked about building a joint user complex of the government. Should we not include the community living room in the joint user complex of the government to make it a permanent venue? Secretary, thank you, Dr. Ho, for the question. We're not quite there yet. We currently rely on tripartite collaboration of the government, business, and the community. We don't have a suitable location within the government to turn it into a community living room. When the program has been running for longer time, we may come up with new ideas. I thank Dr. Ho for giving us some ideas. At this point, we want to rely still on tripartite collaboration. We ask the business sector to offer premises and sponsor the donations while the NGOs run the operation. Mr. Chen Pui-Kong. Thank you, President. I support the CLR. It helps a lot of people. Grassroots people live in public rental housing, apart from SDU household. The government have been combating abuse of PRH, and they are raising the threshold for well-off tenants. So I think that more people will be moving to SDU households. I wonder if the CLR will cover people living in PRH as well. Secretary, thank you. In the public rental housing estates, we have comprehensive social welfare services, including the centers for children and youth. We have neighborhood elderly centers and those for the disabled. So we don't have a plan to provide CLR in PRH estates. Mr. Chris Yip, thank you. I fully support CLRs. It provides a great space for children to do their homework and families to cook their dinners. There are kitchens in CLRs. But some people may not know how to cook, and they are not familiar with the nutrition values of food. On the mainland, they have some shared kitchens that offer meals at low price with nutrition to elderly people. In the future, in the CLR, can we introduce such an idea of elderly canteens or food service so that service users of the CLRs can pay attention to their nutrition intake? Secondly, in CLRs, there are kitchens for people to cook. For the first CLRs in Shamshui-Po, they have vending machines for food boxes. Many singletons don't like to cook, and they can purchase takeout food from the vending machines, and those meals are with high nutrition. So they can either cook or purchase food from the vending machine. Some of them purchase takeout food from restaurants. So they do have options. Thank you. Ms. Elaine Chick. Thank you, President. I fully support the idea of CLR. The Secretary said that we're going to extend some of the CLR projects. However, will some of the CLR not be extended? How are you going to help the service users of those CLRs? Secretary. As we have more CLRs, NGOs may make use of their funding to rent out a space. Currently, we are not planning to not extend any CLR. We ask the NGOs to rent a CLR for 5 years for the one in Mongkok, so that there will be better safeguard for service users. We want the CLRs to give play to their full functions. Ms. Grace Chan. Thank you. The CLRs have been providing great support for grassroots people on different areas. I wonder if the government have any measures to promote experience sharing or establish a regular operational database so that we can record the relevant statistics. And this is how we can promote service that is more popular. Secretary, I think that's a great question. Starting from the first CLR, we have been running it on a database model. we ask all CRRs to make use of the same system. In other words, we are recording the number of people visiting the CRR and the time service have been used. All the CRRs share the same system. For the future, for the new ones, we ask them also to use the system so that we can collect data and analyze it. Mr. Tan Ka-pil. Thank you, President. In Kwun Tong, there are many grassroots people. For SDUs, they are concentrated in Ngau Tau Kok, between Ngau Tau Kok and Sherwood Street Wet Market. Regrettably, in Kwun Tong, we don't have any CRR. We do have community centers, but in there we don't have washing machines or shower rooms. I wonder if the secretary will establish one in Kwun Tong. Yi On Street Market have been abandoned, and I wonder if the government will make use of the AFCD premises to turn it into CRRs. Thank you. For the 5 CRRs that we will set up in this year, we don't have one in Kwun Tong, but I do have a piece of good news. There are people reaching out to us on setting up one in Kwun Tong. We haven't granted any funding yet. I believe that on top of the 5 that we are going to have this year, we are going to have one in Kwun Tong very soon. We'll continue to work hard on it. Ms. Christine Fong. Thank you, President. I think that we all can see how effective CRR program is. I don't think that we should restrict the program in serving the SDU households. In the eastern and southern NT, there are many older estates. We just discussed this proposal of joint user complex this morning. Should we not include CRR in the planning standards and guidelines so that we can provide CRR in joint user complex of the government? Secretary. I thank Ms. Fong for the question. As I said, we try to run the program through a tripartite collaboration of the government, the business sector, and the community. It's better for the business sector to identify premises in locations where there are SDUs clustered. We'll consider any other suggestions too.